Welcome back, everybody. It is going on 11:20. My name is Senator Martine LaRock-Bulick. I am filling in today for Chair Lyons, who is not feeling well, but is also with us on Zoom. So she will be chiming in as needed and is with us virtually. We are going to be looking at H938, which is an act relating to establishing the Vermont Homeless Response Continuum. And the thinking was that we would have Ledge Council do a very another high level walkthrough of the bill, and we would discuss as we feel appropriate, ask questions, chime in, and to just have one more go around on it. This is not markup. We will do markup at a later date, but this is an opportunity for us to look at it again. It's a big bill. It's a complicated bill. A lot of folks have strong opinions on it, so it's important that we understand all of the different sections of the bill and so on. Does that sound like a good plan, folks?
Wonderful.
Wonderful. So whenever you're ready, no rush.
No pressure.
No pressure, no rush. We know you've been really busy this morning. And we appreciate you being here and coming down all of those stairs. Very steep stairs.
You get expensive.
Yeah, I bet you do. Thank you for doing so. Sorry. It's super talkative. Take your time. Say to probably pass over the findings of the legislative intent, since we've already gone over that, and then maybe you could start with either the purpose or the definitions. Okay. I don't know. You all think.
I do have a question about the purpose.
Okay, that's a question about the purpose. So maybe we start there. We need to go out. Thank you, Brenda.
I want to hear holler.
It's very loud.
The whole lot.
Yeah, you go home.
Still coffee.
I know.
That way back, and you can shut this leave away from everybody, but now we're all packed in here.
Thanks for your patience. Thank you for being here with us. I appreciate it.
Meeting with the Office of Legislative Council. Here is 9:38. So we said to skip over the findings and legislative intent, go down to purpose. Okay. So we have kind of a substantial list for the fifth section. To establish a continuum for the supports provided to households experiencing homelessness. Ensure tailored temporary emergency housing is available to Vermonters in a manner that encourages efficient, accountable use of taxpayer funds. Supporting self-sufficiency and reduce returns to homelessness by developing personalized housing plans. Establish clear eligibility criteria and require active household participation. Expand the use of alternative emergency housing models and partnership with municipalities, nonprofit and community-based providers and private landlords. Integrating support services to assist households to achieve permanent housing stability. Establishing transparent accountability measures, reporting requirements and oversight mechanisms. Increasing program efficiency and promoting maximum flexibility in administering these services on the continuum. Empowering local communities to administer emergency housing services with maximum flexibility, and creating a diversified system of emergency housing options, including shelters, specialized shelters, shared housing, post-home models, master lease units, rapid rehousing placements, and providing cost-effective, sustainable support outcomes. So that's the purpose section, and then we get into section 4, and this is the new chapter that's being created in the Green Books that creates the new program.
I think Senator Benson, do you mind if you just sort of discuss? it?
Oh, yeah, please.
Okay, great. I think Senator Benson had a question or comment or wanted to talk about the purpose.
Oh, yeah, I mean, just listening to the different testimony that heard and then some comments about the certain time limits and so forth. The part I was getting a little confused about is the focus of the bill on emergency housing and shelter? Or is it really looking at long-term housing or homeless? And those are kind of like two different things, but I see them kind of intermixed in here, and I'm trying to get focused on, what is the real issue this bill is trying to address?
I think it is that continuum of quicker, easy prevention type services, providing rent before a household has their lease terminated. It could be those shelter services to help immediately when a household finds itself. And it also is permanent supportive housing in the continuum. So that could be a longer term support to eventually transfer the family to sort of independence and stability. So to answer your question, I don't think it's any one thing on the list. I think it's a range of services to sort of meet a particular household wherever they are.
I think I'm struggling with this student because it's a solution, but I haven't seen the problem. I mean, I think we know we have a base problem is there just plain isn't enough housing. And that lack of housing has been causing rents to rise, which has caused people to be put out. So we have people out there who just can't afford housing. We have people out there that maybe they can't afford housing. They also have health issues and physical disabilities. We have people out there have substance use disorder. And we have people with mental health issues that sometimes make it difficult for them to be housed in traditional housing without supports. And people are at different stages of dealing with or not dealing with their substance issues. And I'm trying, I mean, I understand we're doing steps, and for people, that's fine. If we can deliver at the end, which is a home, I'm not sure we can do that under the present situation. And I haven't heard from the people that are actually on the ground, right? Housing organizations. I know one of our local churches was allowing, well, they started having a shelter that had problems. They allowed a tent city in their parking lot. They have told the city this year they just can't do that. No specifics, but it was just more than they would like to deal with. The churches in Montpelier that were doing emergency shelters are still willing, but their congregations have reached the age where the risk of having to be with the people all night, and some of the activities are dangerous. Substance abuse and smoking, which many people do, has fire issues to fulfill. And so I'm think we've got a solution, but I'm trying to fit the solution into what is a very complex problem. We just got more housing, we did a better job of case management and got people in the housing. Some of them would be just fine. Some of them would be.
So Senator
Yeah.
Cummings, I think you've identified significant number of problems that this bill is trying to address, including the last one you mentioned. So I think as we go through the bill, you'll see where each of those issues is being addressed or attempted to be addressed. I think, and the one thing you didn't mention was the motel hotel issue and people not having access to services as they might. So I think as Katie goes through the bill, we'll begin to see how to resolve some of the issues that you're talking about.
Okay, I just want to echo though, what's being said. I met with some of my providers over the weekend and the same issue. There's no place for people to go. There just isn't. It doesn't exist. And of course, there aren't enough services. But there's just the physical space doesn't exist. So I agree that until we have the physical space, I don't see what we can do, but I'm willing to listen and lean in and engage. So go ahead, Katie.
Okay, so we were on section 4, and this is the actual chapter that's being created. I did flag for you last time that we have some definitions that are worth, that are worth spending some time with. I don't know if you want to do that now, or we can keep moving to more substance right now.
Well, are there any questions on any of the definitions? How about we do that? Are there any that
There was disability and eligible house.
you want to go through those again?
Well, there was issues or questions about them.
Want to do those two?
Yes. So disability means the physical, sensory, cognitive, developmental, or mental health condition or substance use disorder that substantially limits one or more major life activities, or that requires ongoing support, accommodation, or treatment to maintain an individual's health, safety, or independence. The term includes chronic or episodic conditions that significantly impact daily functioning, regardless of whether the individual is receiving or is eligible to receive federal disability benefits. And then we have a section later on that talks about how to demonstrate disability for the purposes of this program.
Where did you get that definition?
Oh gosh. I can't remember now. I'd have to go back to my notes.
Brenda Stevens, do you have an answer to Senator Morley's question?
Sure. Brenda Siegel and Homelessness Vermont. The definition is a definition that was, I believe, negotiated last year with the administration. It's their definition, but also it comes from the ADA. It's just very specific version of a definition from the ADA. It's the closest to the ADA that had been created.
So it is the ADA.
The ADA definition has a very, very broad scope, so it narrows it just a little bit, but still gets this purpose of the ADA's definition.
With the administration.
Well, so now they're not wanting a different definition, so I want to be careful about that, but I do know that that is the definition that was negotiated, yeah.
Thank you. Does that help, Senator Morley?
Yeah, just this. I don't know what a major life activity is.
I think that is a definition I could probably get for you. That's terminology that is sort of term of art that shows up in many human services type programs. So
Okay, no, so
Yeah.
sorry.
If we deal with the element, it's called activities of daily living. So, and there's a whole questionnaire I used to give, and now I have to take. Feeding, cooking, and, you know, you get up, get yourself clean, get your clothes on, can you feed yourself, can you walk without help? Just, I think there's 12 activities.
Okay. So someone's gonna
If
determine,
you've been to the doctors, you probably had to fill out the form. I think Medicare requires that it gets filled out at some age group.
Great. Amy, why don't you leave the door cracked? Thanks. Great, so go ahead, Katie, on eligible household or?
So this is one where we read the two definitions together. So first you have that definition of household. And then household, eligible household is a household that is homeless and is physically present and intends to reside in Vermont as evidenced by active participation in a housing, employment, or other AHS recognized plan.
Any questions on that? No, okay. Okay, so I think we get, unless there are other definitions, questions, we could probably go to the next section. Okay.
2202 establishes the continuum itself. It establishes this program.
Page 9.
Yes, page 9. I don't know if my page 9 tracks your booklet stuff. So the program is established or administered by OEO. The office is to maintain a continuum of services that is flexible, housing focused, designed to prevent homelessness whenever possible. It is the continuum shall prioritize early intervention, rapid resolution of housing crises, and equitable access to emergency and permanent housing. The program shall provide temporary emergency housing to eligible households, reduce reliance on hotels and motels, expand use of alternative housing, integrate case management and individualized housing plans, ensure accountability, transparency, and cost efficiency with public funds. And then in 2203, the program components, this is what sort of the structure, the outline of how of the continuum itself. So refresh your memory, it's broken into 5 levels, and that we have a section, a standalone section on each of these levels. The office is to address each of the services up above in separate line items in the budget. The department is responsible for transfers to other AHS departments necessary to implement the services above. And the department within AHS is to maximize federal receipts as applicable for services in a day. So subsection C is directing the office or the community partner to assess the household's need and then place it in the appropriate level of care for the household's need. So this is sort of that statement I made before, meeting the family where it is. It's not necessarily going to be the case that every family that comes in is going to be most appropriately served by a shelter. It might be that there's a diversion service that could be more appropriate and vice versa.
Okay, now that I look at the different levels or not, what was the thinking behind calling each one level 1, 2, level 3, level 4, level 5? Because it seems like the hotels and motels should almost be level 1.
Why did they put them in that specific order? I think I'll remind you that there's sort of that language that if somebody can't be served in the previous level, then they can be served in this level.
Right.
And so level 5 is sort of the stop of last resort in a hotel or motel.
Got it. Wow.
Going to page 11, 2204, this is the prevention and diversion services. So this functions as a primary entry point. Although, again, that statement, although connection can be made at any level. The office shall ensure that these services are provided by an agreement with one or more community partners in each region, in a manner that accommodates an eligible household's disability, if any. The household, upon request for assistance, shall receive brief standardized prevention and diversion assessment to identify some alternatives. Subdivision 2 Prevention includes activities to avert entry into homelessness. Diversion includes problem solving, interventions and supports. So some of that language is taken out of the definitions. And then funds for this are supposed to be used flexibly. 2205 is the shelter services. There's two types, well, really three, but in this section, two types of services, the highly structured and the low barrier. And you'll see that all of these sections start to the extent funds are appropriated for this purpose. But this has the office determining the need for highly structured services and developing sufficient beds addressing that need. The department through the office is to enter into agreements with community partners for the provision of highly structured shelter services for a period of not less than 2 years at a time. Again, that was the language we got stuck on last time. Not that the household is there for 2 years at a time, but that the contract is for 2 years at a time. So I'll flag that in case you want to come back to that. So the highly structured shelters provide programming that emphasizes case management, housing, stability, employment, education, treatment services, and other services as appropriate. Eligible households receiving these services shall participate in case management and other services to the extent of the household's ability. It's meeting the shelters meeting building codes and eligible households needs. If they cannot be met through level 1, then this is a next possible placement. Then B is the low barrier shelter. So this is requiring, again, OEO to look at the need and develop responsive services. The department through the office is entering into agreements with community partners for this service. The low barrier shelters, their goal is to reduce barriers to entry by reducing rules and programmatic requirements that are found in the highly structured shelters, while providing case management and other housing supportive services in a manner that accommodates an eligible household's disability, if any. A stay in a low barrier shelter is time limited, and eligible households shall be transitioned to the more robust, highly structured shelter or permanent housing as soon as possible. Same language about building codes and meeting the previous 2 levels don't meet a family's needs, and this might be a potential fit. 2206 is the specialized shelter services. These are shelter services for individuals with maybe a special medical need, maybe a mental health condition, maybe a substance use disorder. So this has the relevant AHS departments determining the need for these services. And compliance with fire building safety. The relevant AHS departments are to enter into the agreements for these services with specialized shelter providers. So specialized shelters are providing all the same services that a highly structured shelter is providing, but also those specialty services. So the examples here are substance use disorder, mental and physical health conditions. So there'd be specialized services if some household has a specialized need that can't be met in the high barrier shelter. These households do have to participate in case management services to the extent of their ability. And then we have that same language again.
So Senator Benson has something for that.
My knowledge base is not up to speed on all the different programs that are out there. Say substance abuse, individuals, mental health issues. Assuming we have programs also in place to deal with some of those, how do they dovetail into what we're proposing here?
So are you asking us, is there federal money also coming in for these services?
Or other housing opportunities or places that people with these different conditions already exist. And that we need our supporting and And so how does this program dovetail with those? Are we trying to make sure these people who need that support are being tied into those other programs? Or are we trying to create a whole other piece on the side here that deals with similar issues? So
Yeah. I think the answer is it's complicated. I'm probably not the best person to speak to it. I could see the OEO and the Vermont State Housing Authority probably would have much better information. This bill, there's language up above that doesn't say this verbatim, but that this is not meant to take the place of federal funds we're already getting. To the extent federal funds can be used for the purposes described in one of these levels, I think the intention is that money continues to flow into the state and be used however appropriate. Might there still be some standalone housing grant programs that aren't integrated into this program? Yes, I think that's probably true too.
One of the fundamental conflicts, it seems like, with this bill is that this is, like you said, setting up a continuum with the expectation that people move from one level to another, and what we're hearing from folks is that it's much more complicated than that, and it's not a straight line. And so I'm just curious, and maybe we're going to get to it, but if it's too rigid, it seems like it's maybe doomed. And is there a way to make it flexible and kind of porous so that people are able to move up or, across and to and from different levels, depending on what's happening in their lives and with their treatment and their recovery process and all of that.
In the prevention and diversion section, there's at least language that says maximum flexibility. I don't think that language is repeated in the other levels. But I really, maybe your question is a better question for Nolan. Have you looked at the,
Sure.
he has a chart for this. Okay. I know it was sort of carefully negotiated about which funds were available for which purposes. So I think he might be in a better position to address how flexible some of that funding is outside of prevention and diversion.
I think,
I just. No, I'm all right.
Okay. Page 15 is the permanent supportive housing. AHS or any of its departments within the agency are to provide or enter into an agreement for permanent supportive housing that combines long-term community-based rental assistance with voluntary flexible supportive services. Excuse me, such as family supportive housing and other supportive housing services. Funded in full or part by Medicaid, if both the household and the services are eligible for Medicaid. An eligible household receiving permanent supportive housing. These households are required to participate in case management to the extent of their ability. And then we have that same language that possibly turning to this when other levels are not appropriate. Then we have the hotels and motels. We start with some intent language that it's the intent to decrease reliance. However, until there's sufficient permanent affordable housing, the use of hotels and motel services will be permitted under this act. So first, if these are the responsibilities of the department in subdivision 2 with regard to hotel and motel use, and then subdivision 3 is the responsibility of the household. So 2, responsibility of the department to enter into an agreement with one or more community partners to provide supportive services to eligible households in a hotel and motel. Partner responsibility to permit a population-specific placement to the extent certain populations are not isolated from the wider community served in the program. Proposing hotel and motel rates as part of its budget presentation for the General Assembly's consideration. So the past few years, the budget where GA has lived has a statement that says, you can't, DCF can't pay a hotel or motel greater than this rate. So this language is saying, come back to us when you do your budget presentation every year and tell us what that rate should be. And then same thing, in subsection D, use only those rates that are established by the General Assembly. So it's kind of weaving it into the budget process. And subsection E, department responsibility to enter into enter into agreements for the use of blocks, hotel and motel blocks, and negotiate conditions of use for those blocks, including access to providers of case management and other supportive services with no space, with space to provide services as negotiated. And ensuring that services are not provided pursuant to this section on a night-by-night basis. Page 17, a hotel or motel is utilized pursuant to this section. The eligible household shall participate in case management, planning for housing stability or other services to the extent of their ability. And in subdivision 4, we have some language about rules that the motel and hotel have to comply with. Subdivision 5, to the extent funds are appropriated for this purpose. First, between April 1 and November 30th of each year, the use of hotel and motel rooms is capped at 700 rooms per night. And then during the cold weather months, December 1, March through March 31st, utilization of motels and hotel rooms is capped at 1,000 rooms per night. And then we have the subdivision B that says, but wait, any hotels or motel rooms that are used by households experiencing domestic or sexual violence under section 602 do not count towards these caps. And then the same language about, this is sort of the last stop. If you can't, the household can't be, their needs can't be addressed by another level of the continuum. 2209 is other emergency housing services. If you remember, it's broken into 3 subsections and they each have a little header to describe what the specific service or support is about. So A has to do with municipal supports, B is emergency cold weather shelters, C is alternative AHS housing solutions. There's more detail about each of those. Household responsibilities. Then the funds appropriated for this purpose. The household shall qualify for services under the program if it is physically present and intends to reside in Vermont as evidenced by active participation in housing, employment, or other AHS services recognized plan. That should sound familiar because that's pulled right from the definition. So we've already seen that today. Agrees to a coordinated entry assessment that prioritizes the household for permanent housing unless explicitly exempt under the chapter. Engages with a lead case management entity such as a department of AHS or community partner to develop a housing plan and participate in employment, treatment, or other activities. Abides by program rules and refrains from misconduct. And subsection B, the office, meaning OEO or the community partner, is to provide clear written notice to all applicants regarding penalties for fraud at the time of application. But they shall not impose a penalty upon a household acting in good faith that has a immaterial error that was corrected with notice. And 3, the household that knowingly provides false, misleading, or incomplete information regarding their residency, their disability status, or their household composition or other criteria are subject to termination from the program within 30 days after receiving a notice from the department or community partner. Generally, pending the outcome of a relevant Human Services Board hearing, the OEO may refer cases of suspected fraud to the AG's office or state attorney for investigation and prosecution. A household may be terminated from the program for repeatedly refusing suitable placements following documented suitability assessments and reasonable accommodations. Top of page 21, a member or members of an eligible household may be subject to immediate termination of services. So up above, we saw a 30-day window for removal if somebody has false or misleading information on their application. This is when the program can immediately exit somebody from the program. And that's when it's necessary for the safety of others. If the member or members are engaged in criminal activity or misconduct not related to a disability or victimization related to abuse, sexual assault, or stalking. So again, we talked about this last time, but the member or members was very specific that it could be that there's one individual of the household that is engaging in this misconduct, or this behavior. And this would allow the rest of the household to continue to stay in the program and receive services while that one individual was, excused from the program. And subsection E, we have a definition of misconduct, which means documented behaviors that materially endanger the safety of others, involve the intentional destruction of property, or constitute illegal activity.
Yeah, I think this whole section is somewhat problematic in various ways, like my opinion, but I just think abides by program rules. Do you know what the program rules are?
They will be adopted.
In rule, okay. And then the misconduct piece, I totally get it, but like the intentional destruction of property. I just feel like, again, self-regulation is the issue with some folks who are in this, living in this situation, and so I don't know, I it just feels like there's a lot of, ways for people to fall through these cracks. I'm just concerned about that. We can have that conversation later as a group. Senator Lyons is here, but, yeah. Just putting that out there.
There's conversation about that upstairs too. I think there's probably, a good amount of time spent, trying to find the balance there.
And yet it's still here, so. Okay.
The office, either directly or through its community partners, shall prioritize services within the funds appropriated for this purpose to eligible households who are homeless or at risk of becoming homeless and have a member who. So this is a list of a prioritization. If certain households have a member who meet one of these categories, they're more likely to be served in the program ahead of other households. So there's a member 65 years of age or older who has a disability, member is a minor child, member is pregnant, somebody is experiencing domestic violence, dating violence, sexual assault, stalking, human trafficking, or other dangerous or life-threatening conditions. Or is under court ordered eviction or constructive eviction due to circumstances over which the household has no control. Subsection B, proof of a disability shall be verified by. So we have a list of 4. So a healthcare provider licensed or certified to be practicing in Vermont, or a determination or certification from a state or federally recognized agency or program that provides services to individuals with disabilities, or a self-attestation by the eligible household subject to verification by the state or community partner within 30 days when other documentation is not reasonably available at the time of household. At the time of application, I'm sorry.
Yeah, I have written down what's the process for application. Is that also something that's gonna come out in green?
I would assume so. It's not, there's not a process that's set out. Per se. In subdivision 2, the presence of an eligible household member's disability is to be verified by the office or community partner during the household's initial application process and shall be redetermined annually if the household is still receiving services. An eligible household with a member who has a lifelong disability, such as an intellectual or developmental disability, shall not be required to be redetermined annually. This requires ADA compliance in subdivision 4. And that brings us to 2212 time limits for program participation. So again, this is broken down by the same structure that you have already seen with the levels. So level 1, not exceeding 30 days.
So this is the system of how we, okay. We only have 3 minutes, so, and I know you're not giving me well. Why don't we leave it there, 2212, and then we can, next time we look at it, we can take it up there. Is that okay with everybody? But I think this part is really important because it lays out the sort of the system of how it's going to be.
Just curious to, how's the system currently working? Obviously, it's not working that well. It this, is this gonna fix?
Right, part of why it's not working is what Senator Cotton
Right.
said, it's like there's no physical structures don't exist.
There's no money. I mean, there's no money attached. I'm not clear as to who gets the money, to how it gets furnished. There's no personnel attached to this bill. The caseworkers who work with people, it was only 3 years ago, Jane Kitchen found out a social worker, because a caseworker, that finding your home wasn't part of their list of responsibilities. She could, but
Yeah.
I'm having trouble attaching it to
Well, right, right,
Well, that's what I mean, so.
yeah, so more conversations on that. Speaking from it, any other questions before we wrap up? Does Senator Lyons have anything to say before we call it a wrap?
If I could, I would. I have nothing to say. Thank you, Senator.
Thank you, Senator Lyons, Chair Lyons, Madam Chair. All right, we're gonna go offline.